This morning, I'm just going to spend about 5 minutes or so just giving a brief sketch of what we've been up to, and hopefully we'll draw up more discussion questions later. So since April 7th, San Francisco has been engaged in proactively publishing data and reports to communicate the situation and response to COVID-19. What you see in front of you is the homepage for the COVID-19 data and reports, which at the top has basic stats, some summary information about our response, and then further down the page, a number of topics and subpages that go into more detail. I'm not going to go into all these pages, but they cover all the things that a lot of counties are publishing around our cases, tests, hospitalizations, hospital capacity, and so on. Our goal with these pages is to create a trusted public source of COVID data that is accurate, relevant, accessible, disaggregated, and actionable. Now, that vision is an ongoing project and takes a lot of collaboration to get to. To motivate that, I'll talk through the development of one page, the cases, or the maps of COVID-19 cases, rather, as an example. Now, building any new page, any of those subpages requires at least three things. One, a key question. Two, gathering the right data and people. And three, iteratively developing data products with those people to answer that question. In the case of these maps, the key question was, where and to what extent is COVID-19 prevalent in San Francisco communities? Understanding this is important to identify areas disproportionately impacted and to inform the city's response efforts. And making this data publicly available helps to have a common understanding of this with communities as the city adapts its strategies for responding to COVID that are both culturally competent and locally relevant. So trying not to apply the same strategy for all of San Francisco, but applying it differential strategies as needed. Now, to address any question, and this question in particular, you have to bring together a number of people. We have to have people who can drive stakeholder engagement and planning, people who are developing the data products that you see, the dashboards, subject matter and data experts, communications and engagement staff, people who are actually talking to media as well as out in community to bring back the sort of relevant questions to the broader team, and then policy staff. We are very lucky in San Francisco to have wonderful staff from our controller's office that are deployed in the COVID response, who really drive the first two, the stakeholder engagement and planning, as well as the development of various data products. And we support them by doing data set development and automation, making data sets available, as well as governance activities to implement policies in the way that we share that data. And also best practices around dashboarding and visualization and measurement. For each of the other areas, subject matter expertise, communication, policy staff, we draw from across the city, particularly our Department of Public Health, which is the lead agency in our response. We are in San Francisco, the only consolidated city and county, so we are actually engaged directly in that response in that way. We also leverage staff from everywhere because of the disaster service worker policies. We have people deployed from everywhere who are providing great expertise around communications and engagement, as well as policy. Now, these people all have to work together to deliver some things. And so in the case of these maps, and really for anything, there are three basic things that we're delivering with each page. One, a set of visuals. So in this case, maps of the spread of COVID cases, both recent and also cumulative, and dashboards that reflect that same data. Context and content that help to tell the story around the data. These are developed with all of those people that we talked about, subject matter experts looking at it from their perspective, as well as communications and engagement folks who are really making sure that we're sort of addressing the sort of questions that they can anticipate from community and media. And then third, Open data sets that are accessible to anyone. So these visuals and dashboards are backed by open data sets to the extent possible. And in this case, we publish cases by day and by geography over time. That actually also requires us working with the policy staff and governance and engaging in governance activities with our Department of Public Health to make sure that we can responsibly share this data. It's no secret that the pandemic is harrowing, but I'm continually impressed by the spirit of collaboration and problem solving in San Francisco. The work continues as the pandemic shifts around us, but we'll continue the work by focusing on the key questions, bringing together the right people and data, and developing data products that address those questions together. And I'll finish by wishing you all well and safe. I know this is a very challenging experience, and I hope that you all are staying safe during this time.
Jason, thank you very much. That was excellent data and great advice as well. So, you know, government is rich with data. I mean, millions of records about just about everything you can possibly think of. And the role of the chief data officer is relatively new in some cases to some governments. So how has that role and the reach of the chief data officer changed? And do you find that you're collaborating more with departments that may not have collaborated with you in the past?
Yeah, so I think going back to the beginning of CDOs, I think a lot of the genesis of CDOs in local government was around open data. And I think what we've seen over the past five, even 10 years is sort of an understanding that in order to do open data well, you also have to do internal data well. You have to think about data, not just open data, right? All data. And how do you put that to work, and how do you manage it, and how do you think about it as an asset? So I think initially that sort of a flash in the pan, CDOs started, and as CDOs have gotten more embedded in cities, building the case for expanding and really thinking about data culture and the other things that really are important to deliver open data, right? You have to get to open data, you have to do all these other things around it. I think that has shifted with the CDO. Now, in more recent times with COVID-19, I think what's shifted is I don't think the role has changed so much as a re-emphasis or a renewed emphasis on the importance of this. I have the opportunity to talk to a number of peers, and we're almost all doing exactly the same thing. It's slightly different variations, but we're all sort of in the midst of this, and people are turning toward those offices and saying, hey, how can you help? And so what that has done, I think we were very lucky actually to have worked with a large number of departments before the pandemic, and that actually helped us with sort of bridging into helping and doing the work that we're doing now. I would say that actually our Department of Public Health has been an agency that we worked with before, but we're really in it with them. And so that's been, really great. And I think we'll prove benefits into the future as we think about, what do we do beyond COVID-19.
Thanks, Jason. What about tools? Now, you had to employ a number of tools during the pandemic to get the job done. What kinds of tools did you deploy or use or implement? And then will those continue on going forward?
Yeah, so going into the pandemic, there were a handful of things I think that kind of improved our readiness. And there's always places we can improve, but the handful of things. One, we had actually over the past 2 years really engaged in self-service dashboarding strategy using Power BI. Our team, Blake Valento on my team in particular, trained 500 plus analysts through our data academy on that tool, and not just the tool, but also best practices around actually interpreting data. So sort of backdoor, right? Power BI is a tool, but it's a backdoor to helping people understand how to use their data and leverage it. So going into the pandemic, we had that, and people were able to hit the ground running, spinning up things pretty immediately before there was even a central place for data. So that was happening. We, of course, had the open data platform, which everything I talked about earlier is empowered by that. And we've been able to leverage that and the Socrata platform to really tell those stories. We use the perspectives feature for all those different visuals and maps. We embed the Power BI there. So those we use together. So we had those two going in, and then we were just sort of expanding into, it's new for us, but the SCGC, the internal platform for Socrata. And so with Socrata's support and help, we were able to spin up, and alluding to my earlier comment about like data not being placed. Basically what happened was people turned to us and said, hey, you know that thing you do with open data? Can you do something similar for internal data for COVID? We're like, yeah, let's give this a shot. So we spun up a COVID hub, and this has essentially provided a landing pad for a variety of COVID-related data. We don't put things, identified or identifiable things in there, but it does provide a staging area that can complement sort of other data platforms that the Department of Public Health has to provide fewer sources of truth in the COVID response. So we've been able to support departments in that way by making data available there. And then also that's actually helped us with the open data stuff as well, because, and this is our theory of change, our hope is that it's actually really helpful for people to kind of get into the data in an internal platform and kind of, really understand it first before producing an open data product. That can be really helpful for quality and for all these other things. We found that it's provided sort of a staging and platform for helping analysts respond in this very harrowing time.